Hello, my name is Betty Sledge. I'm with the Senior Advisory Council at NWSDS, and I'd like to introduce Lynnette Shaw. She's the Democratic candidate for House District 24. We're going to be interviewing Lynnette today on issues that have to do with seniors and people with disabilities.
Thank you so much, Betty. It's really a pleasure to be here. I appreciate the opportunity to come speak with you today.
Okay, well, we'll get started. Tell us about your positions and your experience that would encourage people, seniors and people with disabilities, to vote for you.
Sure. Right now, while we're really in the middle of this global pandemic that has been, there's so much uncertainty associated with it, the very first thing that I'd say to seniors and folks with disabilities is that you deserve representatives in Salem who understand and have experience with public health and science and healthcare delivery. I have a public health and science education, and I understand very clearly where we are with our current crisis and the importance of safety measures for all Oregonians, particularly those with health conditions that predispose them for worse outcomes. I've organized and worked in clinical patient trials. I've worked one-on-one with patient groups seeking cost-effective and clinically appropriate and affordable health care. And I've trained and worked alongside doctors and nurses in clinical situations for years. So I understand the strengths and weaknesses of our current system very clearly.
Okay, great. Oregon Project Independence, or OPI, is a cost-effective program designed to keep seniors and people with disabilities in their homes. Yet every year, when there's proposed funding for OPI, it's severely and significantly cut. So if you were elected, what would you do to protect funding for this important program, OPI?
Well, first I'd say this: we really cannot balance our budgets on the backs of the most vulnerable Oregonians. It's pure irresponsibility. OPI provides benefits for some of our most vulnerable citizens, and it's important to continue to prioritize that need and prioritize the dignity and the safety and the social benefit of a program like OPI. And by prioritizing funding stability for the Project Independence, we can provide a great benefit for older Oregonians by allowing for longer-term individual care planning that allows folks to work with their doctors and their families and other professionals to understand how aging in place will affect their healthcare decisions and also their finances and their social and family decisions that just have a ripple effect in the community. So the mental health benefits of maintaining independence really can't be underestimated. And we can see better health outcomes and lower care costs too with strategies like OPI.
Okay. So talking about prioritizing state funding, how would you prioritize state funding, including funding that has matching funds with federal dollars, like Medicaid, for instance, for services to an increasing senior and people with disabilities population?
Well, even before our current crisis, I saw too many of our neighbors struggling to afford the essentials that they need. It's like housing and healthcare and things like that. So the pandemic, of course, has exacerbated those problems and exposed inequities like never before. And it's my belief that we're really seeing the beginning of it just right now. So I think it's important for us to really look at where we're spending that money, understand that health doesn't exist in a vacuum, and it's incumbent on us to address the determinants of health really at the source and use our budgets to address those costly determinants like uneven access to health and social and economic opportunities and resources and that sort of thing.
So during this time, there's an increased risk of homelessness and food insecurities. What would you do at a state level so that seniors and people with disabilities no longer face a lack of accessible, affordable housing or proper nutrition?
I think that we really should be looking at things, social determinants of health. And in my public health background, This is really kind of what we're trained to do. Those determinants drive about 80 to 90% of the health outcomes but they receive only about 10% of our targeted funding. So our system is kind of sagging under its own weight right now, but we can reimagine that when we are looking at things like how we deliver our healthcare. We've chosen to place our current cultural value on very much a fee-for-service sort of model, but that really doesn't equip or reimburse healthcare providers for extending care beyond the four walls of the clinic or the hospital. And if we switch to a value-based delivery model, it's a care model that prioritizes wellness and it prioritizes keeping patients healthy outside of the clinical interface. And we can give providers the flexibility to incorporate solutions that bring things like nutrition and basic safety and housing to the table when you're crafting treatment strategies. And the results of that are better outcomes for more people and reduced costs of care. So you get equitable and effective and a less expensive system.
Okay. So what are your plans to improve the health of vulnerable citizens, people with disabilities, even people of color who traditionally suffer from health disparities based on pre-existing conditions?
Right. Well, it's at a time that we're kind of holding together a very stressed out and kind of patchwork system that has seams that are starting to split and show inadequacies of the origins of that system. We can really think about reimagining what our future can look like. We can build a system using our existing infrastructure to provide a public option for folks who need care can get it without worrying about drowning themselves in medical debt or rationing prescriptions or opting out of a recommended care. We can leverage the cost savings of providing that vertically integrated health services in a really comprehensive and patient-centered and prevention-focused model. Those coordinated care models really lower barriers to care that are the origins of disparities in outcomes. And we can update our delivery model to include things like telehealth and value-based care and primary care home models, really centering the needs of underserved and underreached populations in every setting, kind of focusing our systems on providing better outcomes for a larger population and in a more cost-effective way. It's possible. It's very much possible. We have the technology to do that. We have the ability to do that. We have the data. We just need to want it bad enough to elect legislators willing to fight for it.
Okay. Well, Lynnette, those are excellent thoughts, and I'm so glad that you took the time to share with us today. We look forward to meeting you in person one day when the pandemic is perhaps not over, but there's more time to be able to move around. And thank you very much for the gift of your time.
Absolutely.
Again, this is Lynnette. She's the Democratic candidate for the House District 24.
Thanks, Betty. Thank you, everyone.